patients that don't get the treatment appropriately for the diabetes, they're at high risk of developing stroke, heart disease, blindness. They can develop neuropathy, nephropathy. They can develop amputations. They can also develop other issues such as peripheral arterial disease and also erectile dysfunction. So anybody is vulnerable to develop diabetes, but the patients that are at high risk are the ones that are obese, over the age of 40, have a family history of diabetes, and at the same time, if they have lack of physical activity. There are certain ethnicities that are higher risk, and those are actually Native Americans, Hispanics, African Americans, Pacific Islanders, and also Asian Americans as well. Some of the signs and symptoms of developing diabetes is increased thirst, increased urination, fatigue, weight loss, and some people complain about increased appetite. So there's different modalities to actually diagnose diabetes. In our office, we actually use a test called the hemoglobin A1C, and that checks your blood sugar for a 90-day period. And if the number is over 6.5%, it's considered to have diabetes. Some other tests that we actually use is a fasting blood sugar of greater than 126, or a random blood sugar greater than 200 with signs and symptoms of increased thirst, urination, or any type of increased appetite. Actually, diabetes is the reduced production of insulin from the pancreas. Now, type 1 diabetes is actually seen in younger patients less than 30 years old, but it can be seen at any age, actually. And what happens is that the pancreas doesn't produce any insulin. So these patients need insulin to actually overcome their glucose metabolism, and most of the time they're on insulin for the rest of their life. Now, type 2 diabetics is actually predominantly seen in adults over the age of 40, but it can actually be seen at somebody a lot younger than that due to the obesity crisis in the US. These patients don't produce sufficient amounts of insulin, and they have insulin resistance, and because of that, we give them oral anti-diabetic medications. And at the same time, if we can't manage it with just the oral medication, we have to give them insulin as well. It's very important to get tested because it reduces your risk of having complications such as diabetic retinopathy, nephropathy, and neuropathy. And at the same time, it also reduces your risk of being hospitalized in the future. We actually provide an array of different treatments. We have multiple oral anti-diabetic medications, and at the same time, we use different insulin regimens as well. There's actually 2 new classes that came out for diabetes. First class is called the GLP-1 agonist, and this medication actually helps you lose weight, controls your blood sugar, and also reduces your cardiovascular risk. The other class is called an SGLT2 inhibitor, and actually this also helps promote some weight loss and also reduces your risk of having cardiovascular events in the future. Yeah, so there's actually 2 systems that we currently use to actually monitor blood sugars. The first one is the Freestyle Libre, and the other one is called Dexcom. Now, these devices are actually placed on your skin. We can apply it on the actual arm or actually on your abdomen, and actually it detects your blood sugars every 5 minutes. Now, this allows the patient to manage the diabetes in an individualistic manner, but at the same time, it alerts them every 5 minutes if their sugar is very high or very low. Well, we have a dedicated group of doctors, such as endocrinologists, primary care doctors, diabetic educators, and dietitians that want to help you achieve your goal of achieving an A1C less than 7%. And we work all together to actually help you with that in that nature. The beauty of this practice is that we are all integrated into one system, and diabetes kind of goes hand in hand with primary care, with cardiology, pulmonology, and all these other specialties. And the good thing about this practice is that we know what's going on, so if for any apparent reason one of the doctors has a patient that has a really uncontrolled blood sugar, they can just knock on my door and I can assist them in helping them trying to get it under control, and then they can see me in the future.